Hello, my name is Tracy Belcher. I'm here with Beebe's Cardiac Rehab. We're located right in Rehoboth Beach, Delaware, in a satellite location, which is about 10 minutes away from the main hospital in Lewis. And I am joined by some of my team members that you will meet shortly. I have Julian Tugin as well as Julie Watson here. They are our exercise physiologists, and I'm one of the nurses with the cardiac rehab program. So especially as we're dealing with these social distance times and the pandemic, we wanted to give you some options of ways you can exercise at home. We'll go over some aerobic activities as well as some strength training activities that we'll demonstrate for you. So the exercise is important for all of our patients, especially for our patients with heart disease. Anyone that's had any recent heart attack, stent, angioplasty, open heart surgery, or congestive heart failure can really benefit from getting regular exercise. For our patients that come here to cardiac rehab, we work with them and their doctor to get them back to exercise. If you're starting out on your own at home, I would encourage you to touch base with your doctor and see if they have any recommendations or any guidelines about restrictions or limitations for safe exercise at home. I would introduce you to Julie, who's going to talk about aerobic exercise.
Hi, I'm Julie Watson. I'm one of the exercise physiologists here at Cardiac Rehab at Beebe Healthcare. I want to go over a few things with you today, specifically the importance of the aerobic activity and exercise with regards to the heart muscle. So the heart is a muscle, so just as if you were trying to strengthen your biceps, you want to strengthen that heart muscle, and that can be done easily with aerobic exercise. So the difference for the aerobic exercise from resistance training would be using your larger muscle groups and getting your heart rate increased over a period of time. So that can be anything from walking, jogging, running, swimming, or biking. You just want to make sure that you do it for a continuous period of time. American Heart Association recommends anywhere between 30 to 60 minutes, most days of the week. The main goal right now that would be beneficial to shoot for is about 30 minutes, 5 days a week. And that can be broken up into smaller increments if you're having trouble getting to that 30-minute continuous exercise. So you could easily do 15 minutes, so 2 increments. If you are a morning person and would like to take a 15-minute walk in the morning, you could do that, as well as adding a 15-minute walk after lunch, and that gives you your 30 minutes. If that's still a little bit of a time restraint for you, or you're not at that ability where your endurance allows for that, you can easily do 3 10-minute walks. If you have to do less, that's okay. You just need to start somewhere and build yourself up over time. The importance with the duration is you're also going to make sure that you have a proper warm-up and cool-down. That can be anything from some light stretches to a normal pace walk for you. And that should run about 5 to 10 minutes before and after your exercise. With that, your heart rate comes up nice and slow. It can peak with your exercise activity, and it will come down nice and slow for the cool down. So along with the aerobic activity, it's really important to strengthen your muscles. The stronger that you get, the more endurance you have, and the more you're able to do aerobically. So Julie is going to come in and talk to you a little bit about our resistance training that we're going to review with you today.
Well, my name is Julie Tugin. I'm here to talk about some resistance training or strength training. So the American Heart Association recommends that you do that as well as your endurance training or aerobic training. That helps strengthen your muscles, tone your muscles, helps with your bone density. So for the women who have osteoporosis, it's a good idea to do some strength training. Now that's anything that's a quick movement. It's not sustained for a long period of time. You can use resistance bands, you can use your own body weight, you can use any kind of substances at home that you can lift. You can fill a milk jug with some water or sand, or there's lots of sand around here, so you can certainly find some sand or some small rocks. Or you could go to the gym and use the weight machines at the gym or free weights. But if you don't want to invest in all of that, There's also things called resistance bands or TheraBands. So some people who have had physical therapy are familiar with those. And we'll get into those in a little bit, and I'll show you some exercises. But strength training per the American Heart Association should be 2 to 3 times a week. You should have a rest day in between each day, because what you're doing is you're breaking that muscle down. So you want that muscle to recover a little bit before you start lifting that weight again. So when you're pushing through that weight, it breaks that muscle. So you definitely need that day of rest. So do your aerobic activity on that day and do your strength training the next day. So you can alternate days with your aerobic and your strength training, or you can do them together and use your strength training as your warm-up if you want to do that as well too. Let's do some exercises, show you some things, and Tracy will be our person. So you don't have to be always standing. So if you have some limitations standing or you can't stand for a long period of time, you can sit and do some of these. And Julie's going to be the person who's going to stand and do them. So you can do them either way, whatever you're comfortable with. We use TheraBands, or resistance bands as we call them here. They're very inexpensive. You can get them just about anywhere, and these days mostly everybody's online, so you can get them definitely online. They come in all kinds of varieties. So these are the more inexpensive variety, but you can get kinds with handles in them, a little bit more technical, things that you could attach to the door or the wall or whatever you really want to get into them. So this way you don't have to invest in a heavy equipment. We all have different colors, so each color is a different resistance, and you can also change the resistance within the colors by cinching them up. So you want to make sure that you have a good grip on them, but this is going to be a lighter resistance than, say, if you pull them all together, and this is going to be a tighter resistance. So you're going to want to remember that as you go along and things get easier, you're going to want to start to increase that resistance. So the first one we're going to do is what we do here with our free weights is a bicep curl. So you want to make sure that, pull my mask on, that when you're doing it, you have it nice underneath your foot, so not on the tip of your foot, so it flops up and whacks you in the face, and then you have a black eye to go with that. So you don't want that. You want to make sure that you have a good grip. So you want to make sure that you're sitting up straight, standing up straight, and you're isolating the bicep, or the front muscle of your arm. So you're just bending your elbow is all you're doing. You don't want your arms to come out. You just want to bend your elbow just like that. So you're working on that bicep. Okay. So the next one we want to try is what we call an overhead press. We do this also here with our free weights. So again, make sure that it's tight under your foot. Make sure your back is up straight. Make sure you're breathing. So when you're pushing up, you want to be exhaling. When you're coming down, you want to be inhaling. So blowing out and breathing in. All right.
The goal is 3 sets of 10.
3 sets of 10. And then you could increase that as you go along. As that 10 starts to feel good, you could start to do 3 sets of 12. That's what we do here at Cardiac Rehab. If that starts to feel easy, go to 3 sets of 15. If that starts to feel easy, then start cinching up that TheraBand to make it a little bit harder, or switch to another TheraBand if you have a bunch of those, something that's a little bit more resistant. So then what we're going to do is the dual one. We do that also here in the gym. It's the bicep curl coupled with the overhead press, tricep press. So just again, make sure that you have a good grip, make sure they're under your legs, make sure your back is up straight, so you're not hurting your back, pulling your back out. Perfect. Models. So another one that, for the women, this is a big one. No offense, guys, but for your tricep, so you get it. You want to turn around so that there you go. So you're going to have your hands over. You're going to either do it singly or doubly. It doesn't matter. You can double up the thing. Grab it with the other hand, and again, nice and easy. You're just bending your elbow. Keep just bending the elbow, and that's working the back side of your arm. As we get older, women, we always want to work on that back side of that arm. Again, at any point in time, if something doesn't feel right, you don't want to keep doing it. If it doesn't feel right, stop. Maybe your posture is incorrect or your form is incorrect. Try to correct that. Again, if it really doesn't feel right, maybe it's something that you don't want to do. You want to skip that exercise and try something different for that particular muscle. So our next one is side lifts. And again, you can do those in the chair as well. You don't have to. Keep your back straight, make sure your back is straight. Your arms don't want to be bent. You want to have like a nice straight elbow. And you're just going to keep your palms down, and you're just going to lift as high as you can, whatever's comfortable for you. If you have shoulder issues, you might want to not do this one. Now you don't want to just concentrate on just your upper body, but you want to do your lower body as well. So this one kind of does a whole bunch of muscles. We're going to be doing the incline press. So you want to bend forward a little bit. That's going to be a little bit harder when you're seated for this one. 1 foot forward, the other leg straight, as Julie has it straight. Bend that forward knee, and you're just going to lift straight up. You're working the upper body, upper muscles from your arm and your shoulders. Tracy now has it like the opposite of Julie, so she's able to do that, where she has the other leg back bent and that one forward, and able to lift that up. And make sure it's nice and tight under your foot. You have it nicely wrapped around your hands. Now this is our standing squat. And you're going to pull up the straps prior to squatting, so you want to make sure that they're up nice and tight, just to your shoulders. You don't want to go really any higher than that, just to your shoulders. And you're just going to squat down. And you could also do this without the TheraBands and use your own body weight and use the squats, and that helps with your leg muscles, getting your leg muscles stronger. And if you're a person who have balance issues, make sure that you have like a table or a chair nearby, so that if you are doing squats without the TheraBand, but just on your own, that you have something to hang on to for balance, so you don't end up on the floor. And the last one we have is a seated leg press. Okay, seated leg press. So obviously you don't want to do that standing. That's seated. Again, make sure that your posture is correct. Your back is up. Okay, and you're going to do both legs, not just one. So when you do 3 sets of 10 on one side, you of course want to switch to the other side and do 3 sets of 10 as well.
It's important to get that aerobic exercise in, and then you can certainly work these exercises in 2-3 days a week to help build up your muscles so that you can do a little bit more aerobically. And these are great ones that you can do at home along with your daily walking routine and stay in shape during this time.